And I want to upfront say, and I'll repeat it again, India shall achieve these SDG targets for maternal immunity. We are poised, we are having a very robust journey in this regard.
Welcome to the section of Sustainability Karma. I'm your host Rajiv Tikoo. Today we have a very special guest with us, Dr Vinod K Paul, member NITI Aayog. He is the country's topmost policymaker on health. Welcome Dr Paul to the section of Sustainability Karma.
Thank you.
The World Health Day theme this year is very close to your heart. It's on preventing maternal and newborn deaths and also on the health care of women through a life cycle approach. What are your thoughts on this?
Well, I'm very happy that this time there is a focus back to women, to maternal health, maternal mortality and newborn mortality. As you may know, as a pediatrician, my area of work and my journey in academia and healthcare has been in the space of newborn care. And of course, newborn care is intricately linked to maternal care. So I'm very happy that there is a focus back on mothers and children.
How do you look at the progress from MDGs to SDGs, Millennium Development Goals to Sustainable Development Goals?
In the wake of the MDGs, the two MDGs were on reducing under 5 mortality, reducing maternal mortality. So that focus was there, very systematic focus was there nationally and globally between 2000 and 2015. I'm very, very proud to say that India achieved both the MDGs. We could reduce half of under 5 mortality from 1990 to 2050, and we could reduce by 3/4 maternal mortality between again that 1990 base to 2015. So very proud that such an acceleration in survival of children and mothers took place, and we are happy that again it is back on the visibility agenda of the World Health Organization and by default for all of us.
What about SDG 3 on good health and well-being?
Going beyond the MDGs, the SDG targets also encompass 3 indicators that relate to maternal and child issues. So these 3 indicators are maternal mortality reduction. And this time it is not relative reduction, which was the case in the MDG paradigm. Now it is absolute reduction to below 70 per lakh live births. Below 70. I'll come to where the India's numbers are. Then the SDG target is also reducing under 5 mortality per 1,000 live births to under 25. That's it. It's absolute. Now no relative. And then neonatal mortality rate to be brought under 12. Let me say where India's progress in this regard is, and I want to upfront say, and I'll repeat it again later on, that India shall achieve these SDG targets for maternal immunity. We are poised. We are having a very robust journey in this regard. So let me talk about maternal mortality rate where we are. So the last estimate is 2018-20, that's a 20 because it's a moving average of 2 years. Our rate was nationally 97 per lakh live births. What is the goal for SDG? Less than 70. Where did we come from? In 1990, we were huge, 556. So 2020, we are 97 and our target for 2030 is less than 70. We are on track. I'm also very happy to state that even in 9 states had already achieved the SDG target. SDG target less than 70. So 9 states had already MMR of the 2030 SDG goal, which is Kerala 19, Maharashtra 33, Telangana 43, Andhra 45, Tamil Nadu 54, Jharkhand state has 56, Gujarat 57 and Karnataka 69, and there are a couple of states. Even at that stage, we were just at the edge. So the point is that several states are already in the zone of the target of SDG, and we are on track, and this is a huge achievement. If you look at this journey from 1990 to 2020, India has reduced maternal mortality rate by a whopping 83% from that 556 figure to 97 that I was referring to, 83%. Globally, this reduction was only 42% in this span of 30 years. That's what India has done, and this is the kind of potential, capability, energy, and strong system that India possesses. So rest assured that SDG target of less than 70 for MMR is within our national grasp, and we will celebrate that. And I can assure you, when we look at the numbers in the context of, let's say, 2024 or 2023, I'm sure many states would have already achieved the SDG target. So we have a good news on that, and we would like this to be shared to the nation and beyond.
What about under 5 mortality?
Let me come to under 5 mortality rate, which is the second target in today's context. The target is to be below 25 per 1,000 live births. Where are we? In 2020, when the last SRS RGI data is available, we were at 32. So between 2020 to 30, we have to only move by 7 points. And again, full responsibility would state that we are on track. We will hit below 25 before 2030, in fact. But also importantly, even in 2020, when the national under 5 mortality rate is 32, I'm happy to tell you that 11 states and union territories together, 11, have already achieved the SDG target of less than 25. 11 states of our vast nation. It includes Kerala, Tamil Nadu, Delhi, Maharashtra, J&K, Karnataka, Punjab, West Bengal, Telangana, Gujarat, and Himachal Pradesh. We have already done it. Again, moving from 1990 journey base for MDGs and to 2020, the reduction in under 5 mortality rate globally has been only 58%. In India, 73%. We have done so much more acceleration in our child mortality reduction in this period of time. So very proud of that.
What about neonatal mortality?
Neonatal mortality rate, which means the mortality that occurs in the first 4 weeks of life per 1,000 live births. The target is 12 for 2030. The 2020 report shows it to be 20 per 1,000. Okay, 20 per 1,000. Target 12. Again, we are on track. And I can also very happily tell you that urban NMR, neonatal mortality rate, is already 12 in 2020. Entire urban India. And 6 states and Delhi as UT have already achieved the target set for 2030 under the SDGs. So again, the good news, and again, huge progress, much higher than the acceleration that happened in the world. Let me also say, as a last number that I like to give, that in 1990, there were 35 lakh under 5 deaths of under 5 children. Today, this number is anywhere between 6 to 7 lakhs. 35 lakh per annum. Today, 6 to 7 lakh. And clearly, this should become lower much more, because now we are investing even more in health. And we have strong health system. We have the primary health care that I talked about. We have the PMJ in which 6 children and mothers are looked after. And we have all-round improvement. For example, for maternal mortality, we are at 90% institutional deliveries. They are all happening in the institutions where expertise is available through qualified, professional, skilled attendant, typically the nurses and of course the doctor. So there is very heartening progress on these 3 indicators, and WHO, the World Health Day, spearheaded by WHO, for us is an opportunity to talk more about this. But we should not rest on our laurels, because we are imagining ourselves to be a developed nation. We want to move in the direction of a developed nation, and therefore we would aim to achieve those kinds of rates of maternal survival and child survival which fit the developed nation. So we will push our frontier further, and the strong health system, ever increasingly strong health system, our journey will go well beyond SDGs, and SDGs is only a milestone for us. There will be other milestones to push the survival of our mothers and babies and women to even higher levels of excellence.
On a related note, we still have concerns about issues like stunting. What are your thoughts on this?
Continues to be an issue. Yes, indeed. Stunting means a child for his or her age has a lower height. So that's stunting. We have been, seeing a decline in stunting. Let's say between 1990, when the stunting rate was about 58 or 59%, we are now in the somewhere around 35 or so percentage in the last LFHS survey. This is a significant decline already. So there is a trend for decline, and that is going on, and we will accelerate the trend. And I'm happy to say why that's possible. Because one of the important reasons for being stunted happens to be the infections and lack of sanitation. So India has now done a very major revolution in terms of Swachhata and sanitation, and it has reduced burden of tiger diseases. We have that evidence, and that success will surely accelerate decline. Data would show periodicity of the data is such that today's current round of NFHS would demonstrate this. I'm happy this will happen because diarrheal disease and pneumonia, not only they'll diminish with sanitation and other improvements, but also we have higher coverage for rotavirus vaccine, which prevents diarrhea. We have a good coverage, excellent coverage of pneumococcal vaccine and H flu vaccine, which cover and protect against pneumococcus and H. influenzae bacteria, which cause pneumonia, and so on and so forth. So, and also availability of ORS and zinc, availability of services for sick children, because any sickness reduces child's weight and child's growth gets diminished. So when the illnesses are handled properly and they are prevented, particularly infections, through sanitation, I expect a significant acceleration in the trend in reduction of stunting, which I said has been happening ever since.
Going forward, what should be the approach?
We should keep in mind that we should improve the following. Number one, improve early initiation of breastfeeding within 1 hour of birth from the current level, which is about 42%. Every child should be put on breast, start to feed very quickly. Our exclusive breastfeeding rates are about 65%. These should be 100% for 6 months of life. There is a room for improvement, both for the health system to respond as well as for the facilities and the providers and the health and nutrition team to promote all that. And you all have a role reaching out to the people directly through the media. Then another aspect is to look after the care of small babies, because the babies who are born small, already stunted, or they need extra help. So kangaroo mother care, express breast milk, need to focus on that. Again, this is to be done in the facilities, but also a lot more in continuing way in the families, in the households. There should be an emphasis on that to make further difference. And then introduction of semi-solid food, we call it complementary food, at 6 months, and optimum intake of complementary feeding after 6 months is also an important area for our work. Currently, about half of the children 6 months to 8 months are offered complementary feeding, are initiated. It should be 100%. Because after 6 months, breastfeeding is not enough. So complementary feeding should start. So we need a behavior change. Movement, awareness, support for families to introduce the additional food to be able to meet the energy requirement of our children, and then build up this systematically in such a way that a child who is about 14 months consumes, in terms of energy, half of what you and I take. Can you imagine that a 14-month-old child has requirement of food and energy 50% of what adults eat? So that is a gap that we should correct. So this change in feeding pattern, focus on small babies feeding, breastfeeding, timely complementary feeding is an agenda which will make a difference, and we should all work together. Poshan Abhiyan focuses on these areas in a very central way, and there is a Poshan Pakhwada going on, and there will be Poshan Ma. But then every day, every week is actually a portion time for children, and we need to do that. We also need to keep in mind that a part of underweight and stunting and wasting occurs at birth.
So it calls for more focus on mother's health.
Mother's health is very important. Her nutrition is very important. And particularly if she herself is wasted and short, had low BMI, then she should be helped with extra food, which is available in our national program. Likewise, complementary feeding partly is available as take-home ration, but that should be consumed, and household things should be consumed. When I say complementary feeding, I just want to return for a minute there. खाना वही है जो घर में है, बच्चे को उसके तरीके से बना के वही दाल, वही चावल, वही सॉफ्ट रोटी, वही आलू, वही दूध और वही शक्कर, वही तेल, वही बच्चे की भी खुराक वही है, कोई अलग से नहीं है, लेकिन उसको हमें ज़्यादा बारी देना है, अच्छी तरह से बना के देना है, एनर्जी डेंस हो, ऑयल हो उसमें, ताकि वो थोड़ा अमाउंट बार बार खा सके.
What about pregnant women?
तो मदर के लिए भी मैं ये कहना चाहता हूँ कि टेक होम राशन है हमारे पास, लेकिन और भी उससे ज्यादा पहले से ही प्रिपरेशन हो, so that when she goes into pregnancy, she is already having good reserve. and that will improve the birth weight of the babies. And also likewise, if there are any infections, if there is anemia in the mother, so that should be tackled. So that part will come to mother's health, the stunting and wasting at birth. And then after the baby is born, good nutrition, the way I highlighted, as also protection against illnesses and infection and early treatment and vaccination will make a difference. When you bring it all together, we shall be able to accelerate our stunting reduction. And I know that given the fact that our families are better off now, they are more educated and aware, and the state governments, central and state governments are working together through Poshan Abhiyan and our National Health Mission activities, we are on track to accelerate our achievements.
You at the same time to the progress we made on communicable diseases, but at the same time, non-communicable diseases are becoming a big concern, particularly cardiovascular diseases. So, what are we doing there?
Well, the cardiovascular diseases are a huge issue now, and they are a very major cause of mortality. And these particularly include, hypertension. Then you extend the non-communicable, which leads to cardiovascular events and so on. When you extend it, then it is also diabetes and cancer and so on and so forth. And they also work through chronic kidney disease and chronic liver diseases, etc. There are 2 points. One is to prevent. And prevent means avert those risk factors which predispose to non-communicable disease. And these risk factors are lack of obesity, no obesity, correct weight. This is avoid tobacco, avoid alcohol, which is physical activity and exercise, which is so very important. So, and a good lifestyle, a good lifestyle which is, relaxing, you have good physical activity, you eat healthy food, and you do not ingest things which cause problems such as tobacco. And then secondary prevention occurs through Ayushman Arogya Mandars by screening systematically every year. Every person above 30 years of age should undergo screening, and that's part of our comprehensive primary health care. So if you detect a problem that I have hypertension, then you improve prevention, physical activity, low salt, and so on. And then also you may, if required, take a simple tablet to control your blood pressure. And same, diabetes prevention to the extent possible, otherwise therapy and lifestyle change. So that's how it will work. And therefore, to me, the end point of requiring how to treat myocardial infarction, heart attack, and stenting, and dialysis and care, all that can be avoided through efforts to primarily prevent it as much as we can with good lifestyle, and secondary prevention of detecting and knowing that you have and then controlling it. That's the paradigm. And this is the only way that you can address. You cannot wait for heart attacks to happen and strokes to happen.
Thank you for sharing those important takeaways. It was nice talking to you, Dr. Paul. Thank you very much.
Thank you.
Hope you like this program. This program is also live streamed on All India Radio. We look forward to your feedback on our WhatsApp number 9818120554. For participation in this program, write to us at sustainability.karma@gmail.com. Looking forward to meet you again at the same time next week with a new episode and a new guest. Till then, goodbye from all of us. Sustainability Karma, a podcast series on sustainable development, sustainability and ESG.